A new report from Disability Law Colorado documents concerns of dangerous conditions at Southern Peaks Regional Treatment Center. It's a psychiatric residential treatment facility in Canyon City. News 5 senior reporter Megan Glova has the details.
The most concerning findings include excessive restraint and seclusion, plus conditions kids are comparing to jail. I spoke with DLC about their findings and a former patient from Colorado Springs. Jayla Hunt felt positive stepping into Southern Peaks Regional Treatment Center for the first time back in June.
I was hopeful for different treatment and different, resources that inpatient or outpatient couldn't provide me.
The 17-year-old transferred to Southern Peaks from Cedar Springs Hospital in Colorado Springs in need of behavioral health treatment.
The experience was okay from the start. To be fair, we didn't have many options. It was one of the only facilities that would accept Jayla.
Hunt's mother, Katie Gallegos, says Southern Peaks was great until it wasn't. Her concerns began with an influx of incident reports that she received from the center.
Using a curse word, for example, would get an incident report. Lots of physical restraints.
Those physical restraints, Hunt says, were a common occurrence.
They would hold our hands behind our back, to stop us from hurting ourselves.
But this is 30, 40 minutes at a time.
Mm-hmm. You're too, dangerous. They'll lay you down. They can be kind of traumatic.
Hunt says this happened to her multiple times a week, on and off. 3 in one day was the most. Even from what you're describing, it seems like some of them experienced more punishment than actually getting help.
Yeah, I think that's certainly been the perception of some of the children we've spoken with. We've spoken with children who are in juvenile detention facilities who prefer to be there.
Emily Harvey is the co-legal director at Disability Law Colorado, a state protection and advocacy organization. Between what they saw there plus interviews with nearly 50 children, they released a report on their findings.
The use of restraint and seclusion is significantly higher in this facility compared to others that are similarly licensed.
That report lists that physical restraints were used an average of 75 times per month as of May 2025. Other key findings include lack of consistent mental health treatment, substandard conditions, and fewer positive programs for kids.
At this point, we're still hoping that they see this as an opportunity to do better.
DLC has not been back to Southern Peaks since releasing the report. They're now calling on the facility to reduce relying on restraint, make adjustments to staff training, and ensure consistent access to therapy. Gallegos got a call from Southern Peaks last Friday.
Jayla had broken her arm.
An accident Hunt admits was her doing, but it was enough, amidst other concerns, for Gallegos to remove her daughter from Southern Peaks 2 months early.
If there weren't for a few select staff members, I would have taken Jayla out a long time ago. There were some incredible people that I think really helped in her treatment, her healing journey with our family therapy.
Both say what the facility really needs is more staff. Staff considerate of mental well-being.
Just be there for them and let them know that whatever they're going through is going to pass. And they're not in the situations that they were in before they were there.
I did reach out to Southern Peaks for comment on Wednesday through the contact form on their website, but as of now, no response yet. I also called on Saturday. Someone did say they would pass my information along, but as of now, I've not heard back. In studio, Megan Glova, News 5.